I hope welcome to Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, family nurse practitioner, doctor of nursing practice, owner of Wells Legacy Health and Wellness. I want to welcome you to another amazing Wellness Wednesday. Tonight, we're going to be discussing a topic that many of you may not think about, but it's something that all of us have, we all deal with, and we all have this organ within our body. And so it's something that impacts everyone, no matter what age, no matter what your gender is, you are impacted by this organ, this body system. The month of September, as you all know, I am an educator by heart. I love to make sure that my patients, my family, and my friends have the information that they need to, one, make wise health decisions and choices, and that you can advocate for yourself. And our mission and our motto is to make sure that you all can create a legacy of good health. And we do that by, one, informing you guys on these topics. As you all know as well, each month I like to highlight different health topics that are prominent or celebrated or highlighted during any given month. So the month of September, there's quite a few, and it was hard for me to narrow down which one I wanted to talk about. However, in clinical practice, this is something that I discuss with my patients all the time. And so this month or today, we'll be discussing urological health, so urinary health, right? In the month of September, urological health is one of the health conditions or health body systems that's discussed. And there's so many individuals who deal with urinary problems, and not many people talk about it. And so tonight we're going to talk about it, right? So again, welcome to Wellness Wednesdays. We're going to jump right into it. In the United States, there's about 50 to 60% of women and men who deal with urinary tract infections. And that's just one part of your urological system, right? Your urinary system. How many times have you gone to your healthcare provider and you've been asked questions about how often do you use the restroom? How often are you getting up to going at night to urinate? Are you having any urgency, frequency, burning, pain on urination? Are you noticing any blood when you urinate? Are you having any leakage? Like if you were cough, sneeze, you jump, run, things like that. Are you dealing with any leakage when it comes to your urination, your urinary tract? And it's important to be honest, right, with your healthcare provider, because if we don't know that you're dealing with something or you're not being honest, then we can't provide you with tips and suggestions on what you can do to help those symptoms. So with the physical exam, and we talked about that, some of the questions that should be asked, everyone should have a physical exam every year, as we talked about. And then your provider should be asking you questions about your urological health. How are things going? And so hydration is key. I know we've talked about making sure we're drinking plenty of water. You want to make sure that when you urinate, that you're actually looking at what's coming out. You want to take a look at it. Does it have a funny color? Does it have an odor? Does it have a smell? That can tell a lot about your health and what's going on ultimately with your kidneys and with your body. And so hydration, number one, is key. You want to make sure that you're drinking, as we mentioned before, everyone is different, but 8 to 10 cups of water each day is recommended, right? And so our urine should be clear. It should not be cloudy. There should be no blood in there except for certain conditions. And that's women, when we have our lady time, as some individuals call it, or you have your menstrual cycle, there may be some blood you may notice some blood, and that's normal during those times. However, other times there should not be any blood. You should not have any pain on urination. Your urine should be clear. It should not be cloudy. With the caveat, I'll throw this out there. If you're eating or drinking certain foods and certain beverages, it can change the color of your urine. And so if you notice a strange color or odor, it might be something that you're eating. And that may be okay, right? So healthy kidneys and healthy urinary tract will get rid of or help you get rid of things that you shouldn't necessarily have in your body. So a lot of vitamins, a lot of medications are excreted, or your body gets rid of it through the urinary tract. So drinking water is number one. That's the key. Again, 8 to 10 cups of water per day. And there are some individuals who can't have that much water, and that's okay. You know your health, you know what you deal with. Make sure you have those conversations with your healthcare provider. Another important factor of the urinary system is the pelvic floor. So with your urine, let me go back. With the urinary system, you have your bladder, you have the ureters, which are the little tubes that lead up to the kidneys. And then you have the urethra, which is where the urine comes out of. And so you can have an infection in the lower urinary tract, which is the UTI. You can have an infection of the bladder, which is typically called cystitis or bladder infection, which we also term urinary tract infection. But the term urinary tract infection or urinary tract is a broad term because it speaks of the entire urinary tract. So you can have an infection with anywhere within those organs that I just mentioned, and it could be considered a urinary tract. But typically we denote it as lower or upper urinary tract. And the one that we are most commonly treating, or that individuals most commonly deal with, are the lower urinary tract infections. So what are some of the signs of a lower urinary tract infection? The burning, the urgency, like you gotta go right now. Pain on urination. If it's really bad, there can be some blood or, really funny colors in the urine as well. Cramping could be a sign of urinary tract infection. Some individuals don't have any symptoms, and that's when it can be pretty bad, because these individuals can have a urinary tract infection and not know it because they're not really feeling the symptoms, or they're not picking up on the symptoms. And those symptoms, that infection can progress and then cause an infection within the kidney. So it's important, again, as I mentioned, to one, pay attention to your body, know your body, understand your body and how it functions. So that way, if there's something that's off, you can pick up on it quickly. So moving into some more discussion on urinary tract infections. UTIs are common, especially in women. Men can get urinary tract infections. However, their urethras are longer than a woman's urethra. And so the woman's anatomy is in a position to where, because of the way things are created and the way things are situated, we are at a higher risk of developing a urinary tract infection. So hygiene is important for women. And we start telling and educating our little kids, little girls, about how, right front to back. We don't want to go back to front because you can introduce bacteria to the urinary tract. And so it's important, one, drink plenty of fluids, good and proper hygiene. Some statistics that talk about urinary tract infections in the United States. 8.1 million doctor's visits in the United States each year, on estimation, are due to a urinary tract infection. That's a lot of doctor's visits. Data shows that approximately 50 to 60% of women will experience a urinary tract infection in their lifetime. So again, drinking plenty of fluids, knowing your body, and knowing when to get treatment. So if you're experiencing symptoms after a few days, if they don't go away, you have this urgency, you just feel like you have to go to the restroom a lot. Some of the first signs is, someone's urinating a lot. You gotta pee. Like, I gotta pee. 10 and 12 times a day. And I'm like, what is going on? And these individuals come in and get tested, and they have bacteria in their urine, which tells us that they have a urinary tract infection. So it's important, one, take care of yourselves, know your bodies, drink your water, know the signs, and get seen quickly, or sooner rather than later if you think you may have a urinary tract infection. Because the last thing we want to happen is that that develops into a kidney infection, urinary tract infection, and you begin to develop a kidney infection. So we don't want that to happen. Another part of the urological system that we talk about a lot is the pelvic floor. And this is something that issues with this can impact both men and women. And so mostly we hear about it with women, after you've had babies or you've had surgery, things of that nature, it can weaken the pelvic floor. There's so many different things that can weaken the pelvic floor. With men, they can experience different signs and symptoms as well of, weakened pelvic floors. You can have incontinence, leakage or dribbling of urine. Those are some of the common things when we look at pelvic floor dysfunction and pelvic floor issues. And it's a problem, but not many people talk about it, right? Not many people are open to having those conversations. And so when you're going to see your healthcare provider, those conversations should be had, and your provider should be asking those questions about, are you having any leaking of urine? Are you experiencing any pain, different symptoms that you may be experiencing, especially women who have had, my computer is doing something weird. So I hope you guys can still see me okay on Instagram. I'm going to keep going. On Facebook Live. I hope you guys can see me okay and that you can hear me okay, because my computer is doing something weird. But anyway, I'm going to keep moving along. Studies indicate that women who regularly perform pelvic floor exercise experience a reduction in the symptoms. So I don't know if anyone has ever been talked about, have a conversation with their healthcare provider, and they recommended pelvic floor rehab. Well, part of that is pelvic floor exercises that you do, and Kegels are very effective in many instances. Some instances not so much so, and that's okay. If you're having those issues, you can definitely talk with your provider. They may send you over to see a specialist, and those individuals can help you rehab the pelvic floor. Thank you. Someone just posted that both are good, so I wasn't sure if there was an issue. I'm seeing a weird something going on with my screen here, but thank you so much. Bladder health and aging. Some people think that as you get older, leakage of urine is common. Oh, I'm just getting older and it's a part of aging. That is not true. That is not true. We have patients who are in their 80s, 90s, and on up, and don't experience any bladder issues and no leakage and things like that. So it is not common. I know we see a lot of the commercials on now about the different Depends and the other bladder leakage products that you can use. It is not normal for an individual to leak urine. Something is going on. There's weakness there. There's some type of disease process that's going on, and it's not normal. So I want to put that out there. Let's not normalize that, right? If you have that issue, there's nothing to be ashamed about. There's things that you can do to help control it. There's different medications that you can be placed on. There's different treatments that you can use, as we mentioned, the pelvic floor exercises. But getting down to the bottom of the situation will take having that open, honest conversation with your healthcare provider. So that if you need to go and see a specialist, then you can. With age, the bladder capacity may decrease and urinary frequency may increase, but that does not speak to leakage of urine. And there's things that you can do to ensure that you don't develop issues. There's bladder training exercises that you can do. So we want to make sure that you're getting your annual physical exam. And if you are having bladder issues, checking to see if they're related to any other medical conditions, because certain health conditions can put you at risk for urinary incontinence. If you have, an excess of fluid in your body, ascites or edema or congestive heart failure, those things can put you at risk for having to urinate more frequently, right? And so if you have issues with your kidneys or enlarged prostate for men, can cause issues as well. So again, every organ system is connected, and it's so important to get checked out and get checked out early. Get those annual physical exams. Make sure you're going to a provider who is doing a thorough, detailed job at providing you the care and evaluation and treatment that you need. Dietary, your diet has a lot to do. As I mentioned earlier, you can eat certain foods, you can drink certain things, and it could change the way in which your urine looks and smells. And so certain things that you drink or could have more acid in there, and that could be irritating to the bladder. Something that, we think is used to help the bladder could also be causing some issues with you. Okay. So we think, oh, you can take cranberry for good urinary health, but for some individuals, that could cause them to have symptoms that mimic incontinence or other urinary issues. So make sure before you start any supplements that you are talking it over with your healthcare provider. High sodium diets can contribute to water retention, which then increases your risk of developing urinary issues. Data suggests that decreasing sodium intake can help maintain proper fluid balance, right? So if you have the proper fluid balance, it can then support a healthy urinary system. Overactive bladder is another issue that many individuals face and deal with on a daily basis. 33 million Americans deal with overactive bladder each year. That's a lot. That's a lot of individuals. Overactive bladder, what is that? You feel like you have to urinate often, frequently, multiple times. You feel like you can't hold your urine. You got to get there right now. And there's so many different types of urinary incontinence. There's urge, there's stress, there's mix where you're experiencing the two symptoms together. And then you have overactive bladder. Those are some of the symptoms are the same. However, once they've ruled out infection, they've ruled out incontinence, then they do more specific testing and treatment to determine whether or not you have overactive bladder. Medications can be used to treat overactive bladder. Lifestyle modifications could be a way of treating overactive bladder. Bowel habits and bowel training. Not bowel, but bladder habits and bladder training can help in helping individuals decrease the symptoms of overactive bladder. You see a lot of medications that are being televised, and you see the ads for medications that can be used to treat overactive bladder. Again, have that conversation with your healthcare provider. We talked about the lower urinary tract. We talked about the ureter. We talked about the UTIs, which is the lower urinary tract. You have the ureters, which are the little tubes that lead up to the kidneys. And so kidney health, one of the first things we see when individuals are having kidney issues is we get a urine sample and we check the urine to see if there's any issues. And the result of the urine sample tells us, there's something going on with these kidneys, and we need to make sure we're looking into that. So when you go to your healthcare provider, they should be taking blood every year, at least once a year at minimum. And they also should be getting a urine sample from you. They'll send that to the lab. They're going to perform some tests, look at the electrolytes, look at how your kidneys are doing. There's some results that you may hear. You should hear or see, or your healthcare provider should talk to you about your BUN and your creatinine and your sodium level and your glomerular filtration rate, which is the GFR, that tells us how well your kidneys are filtering waste. So there's certain labs that are specific to your kidneys, and your healthcare provider should be reviewing those and ordering those and reviewing those results with you. And if you have any abnormalities, then we want to make sure that you are being followed up with this proper specialist, or your healthcare provider is monitoring your kidneys. If you have a family history of kidney disease, if you have diabetes, if you have high blood pressure, those are all things that could put you at risk for developing kidney disease. And when kidney disease progresses, it gets to a point where many individuals have to go on dialysis. And so we want to make sure that we're being proactive, that you are asking questions, and that your healthcare provider is doing you justice by ordering and performing the correct test and examination. Incontinence and prevalence. We talked about overactive bladder. We talked about urinary tract infection. And so right now we're going to focus just a little bit on incontinence. It's not uncommon, and it can impact individuals of all ages. I think we kind of spoke that already. But data shows that 25 million adults in America experience some form of urinary incontinence. And I just mentioned we have stress incontinence. That is if you were to cough, sneeze, laugh, bear down, jump, you have some leakage. And then you got the stress, and then you have just went out of my head. Stress incontinence and oh my gosh, it just went out of my head. Urge. So you have the urge to go to the restroom really quickly. And if you don't go right now, you're not going to be able to make it to the bathroom. And so it's stress and urge incontinence. Some individuals actually experience a combination of both. Seeing a urologist, seeing a gyno-urologist, someone who's a gynecologist, but also a urologist for women, can do really good in terms of helping you to determine what the problem is and help you narrow down what type of incontinence you may have. And that's when we get into the whole incontinence care. Pelvic floor rehab can help with that. The Kegels can help with that. But sometimes it's eliminating things from your diet. Getting rid of certain foods or certain supplements. I had a patient who came to me who was experiencing some incontinence, and we had her look at her diet, and she started taking a urinary supplement because she heard that it was really good for her, cranberry, right? And for her, she had the reverse effect. It was causing her to have the cystitis, which is the inflammation of the bladder, which mimic a urinary tract infection, and was causing some stress incontinence. Once she eliminated that from her diet and stopped taking it, the symptoms went away completely. So just because something is mentioned and it may work for someone else doesn't necessarily mean it's going to work for you. I know how we do. You have a friend, I started on this really good vitamin. It's really good for me. You should try it. And then we go and try this diet or this supplement, and it does not work the way that it's working for your friend or your family member. So always consult your healthcare provider before you start a new supplement. For men, prostate health. We talked about that. Prostate enlargement can affect urinary function in men. So when you're going to your healthcare provider, if you're noticing a decrease in your urinary flow or your stream, you notice any dribbling, if you're having a hard time initiating urination, if you're standing there and you have to go, you feel the fullness of your bladder, but you're not able to completely start the urine flow, or it starts and it stops, or there's some discomfort there, or there's leakage or incontinence there, it could be due to a large prostate. And so it's so important for men to get their prostate examined once you're a certain age. And I believe it's around 40 to 45 for men of color, brown, black, what have you. It's so important that you get your examination every year. And that's something that can be done at your doctor's office. You don't necessarily have to go and see a urologist. However, if they find something abnormal on the physical exam, they should be referring you out to a urologist for that. Medication can be used for enlarged prostate, and sometimes surgical intervention is needed. Lifestyle factors. So, smoking, excessive alcohol consumption can lead to bladder and urinary tract problems. So, look at what you're doing in terms of your habits and see if those things are impacting you overall. Um, your urinary health is important. And just like every organ system, it's all connected. Your urinary function can tell us whether or not you have something going on with your heart. It can tell us whether or not you have something going on with your kidneys. There's so many different things that we can find out just by looking at your urine or asking you questions about your urinary health. We want to make sure that you have everything that you need to live your best healthiest life. And even in the topics that aren't easy to talk about, even the topics that aren't as popular, we're still going to touch on them. We're still going to deal with them because I want you to be comfortable with what's going on with your body and having those conversations with your healthcare provider. If your provider is not asking you questions about your urinary health, you need to fire them and go get somebody else, right? You need to make sure that the service that you're paying for, that you have trust in your provider, that they're going to do everything that they can in their power to make sure that you are healthy. And if there's something wrong, that they are researching it, they're getting the testing done, they're screening you, they're giving you the options, they're providing you with the treatment and or referring you to a specialist who can help you in those areas. As I mentioned earlier, September has quite a few health topics that are highlighted this month, but I thought this was an interesting topic. It's one that we don't necessarily talk about, but we're going to talk about it. We're going to talk about all the things that aren't popular, but can impact your overall health. This is Dr. Latoya Wells. Thank you again so much for being here for Wellness Wednesdays with Dr. Wells. In the month of October, I know I'm a little ahead, but I want you guys to be prepared. I'll be sending out some additional information, but I have a 30-day challenge for you when it comes to the month of October. This month is September. It's also Social September. So make sure you're getting out and you are interacting with others and you're doing things to make sure that your presence is known in society. Be safe. Take care of yourself. If you're sick, stay home. Be mindful of your immune system. Take care of yourself. Get rest. Drink your water. Take your supplements. As long as you've talked it over with your healthcare provider, they don't have any adverse effects on your health. Stay safe. Be well. This is Dr. Latoya Wells, Doctor of Nursing Practice, Family Nurse Practitioner, owner of Wells Legacy Health and Wellness. Until next time, we'll talk to you later. Have a great evening. Goodbye.